Please be advised, this video contains graphic surgical content, including scenes of bloody gums during the surgery. Viewer discretion is advised.
Here, the surgeon shows that the periapical lesion is active and infected. After sterilizing the patient, anesthesia procedures are performed. In the first step of the surgery, the flap is opened traumatically, in the area of teeth number 4 and number 5. At the same time, the lumen of the periapical lesion is dissected, so that it can be cleaned in the next steps. Because there should not be any remnants of this injury. The extraction of tooth number 4 is performed traumatically by placing a finger in the buccal plate to preserve the bone. For tooth number 5, which is a little more difficult to remove, a thin periatome and piezo device is used to loosen the tooth in its place and remove it traumatically. At any stage where there is a possibility of pressure on the bone plates, that part is supported by placing a finger. Very slowly and patiently, the surgeon loosens the PDL ligaments in place. This process continues slowly and patiently using different tools. Here a part of the tooth crown is removed. Next, tooth number 5 is extracted using a periatome and very small pens and slow movements. The surgeon does this so carefully that the periapical lesion is removed along with the tooth. The next step is washing the distance between the lesion site and the buccal cup. The surgeon makes every effort to preserve the bone tissue. You can see that the crest bone in the tooth area is completely preserved. The curettage process is repeated consecutively. Again, using piezo tool, the tooth socket is cleaned. The important point in fresh socket surgery is to extract the tooth, remove the lesion, and clean the area as carefully as possible. In the next step, drilling is done according to the protocol. The accuracy and concentration of the surgeon is very important at this stage because the vibration of the drill can damage the bone tissues. Washing is done regularly. The next step is placing the implant bases. Here the surgeon used the ICX implant. The surgeon checks the torque first by using a machine and then manually with a ratchet to ensure all things such as the angle and depth of the implant are correct. Because the distance between the implants is less than 6 millimeters, the surgeon uses carbide tools to ensure the success and longevity of dental implants. Also implements the principles of horizontal discrepancy. After cleaning the bone and removing any excess tissue left from the previous tooth, the surgeon starts to modify the shape of the bone into an oval to prepare the place for the flap. The next step is to close the healing abutment because the torque is above 25 newtons. After that, it is time to put the biomaterial. The surgeon uses allograft powder, and because the bone tissue has already been preserved, the level of technical sensitivity is less at this stage. Blood supply is checked, and due to the sufficient thickness of the keratin tissue, there is no need for connective tissue surgery. After cleaning the bone, the surgeon uses a collagen membrane to cover the perforation areas. At this stage, the flap is returned to its place as a retention-free. The surgeon starts shaping the membrane to ideally fit between the healing abutments. In order to free the flap from tension, the surgeon makes releasing incisions to remove the pressure from the flap. After checking all the cases, the surgeon starts to fix the flap from the most distal point where there is a freeing incision. This work is done using 5.0 nylon thread. Thank you for staying with us until the end of this video.